نه فاز 5 نفر باشه. شلوغی که دیگه برای شما نمیاد دیگه. 5 نفر بقیه میگه. Superior rectus. Okay, superior rectus and inferior rectus, lateral rectus, medial rectus. Okay, these muscles, superior oblique muscles. Okay, and inferior oblique muscles. This oblique, inferior oblique muscles. Okay, and
Where is superior or oblique? Superior oblique.
okay, superior oblique muscles. Important is eyeball, okay, eyeball, and another muscles, ciliary artery, okay, ciliary nerve, optic nerve, central retina artery, and central retina vein artery, optic nerve, and another structures of the eyeball layer. This is this one, sclera, fibrous tunica contains two parts, sclera and corona. Okay, sclera. Another layer, this layer, choroid, vascular layer contains three parts, choroid layer, and this is retina. Okay, retina. Retina contains two parts. Okay, contains two parts, optic part and non-optic part. Between optic part, ora serrata. Okay, ora serrata. This part, ciliary muscles. Okay, ciliary muscles, ciliary process. Okay, ciliary. This is ciliary process, and another part. This part, iris. Okay, iris. Okay, and another is optic chiasma, optic nerve, superior oblique muscles, lateral medial rectus, and inferior rectus. Okay, inferior rectus, lateral rectus muscles. This one, this is okay. No, frontal sinus, frontal sinuses. Okay, frontal sinuses. This frontal sinus, and this is this one vomer. Okay, perpendicular plate of the ethmoid point and vomer point. Okay, vomer point. Okay, and another part,
Frontal sinus.
sinuses. Okay, are the frontal sinus. So no problem. Frontal. Okay, no problem. Okay,
Perpendicular plate of ethmoid.
This muscles, levator palpebra superioris muscles, levator palpebra superioris muscles, lacrimal gland contains two parts, lacrimal gland, orbital part and palpebral part. Okay, this palpebral, superior palpebral, inferior palpebral, lacrimal apparatus. Okay, this part, canaliculus, superior canaliculus, inferior canaliculus. Okay, superior canaliculus or lacrimal, superior canaliculus and inferior canaliculus, palpebral part of lacrimal gland, and this part, okay, orbital part of the lacrimal glands. Okay, and okay, no.
Finish.
But this muscle, this is a central retina, central retina artery, central retina vein, and branches of retina, central retina branch artery, and central retina branch of vein.
Veins.
Okay, veins.
And arteries.
Okay, muscles finished. Okay. This part, pupil. Okay, pupil. Iris. Pupil. Okay, pupil, iris, and this part. No. Choroid. This part, ciliary, contains three parts: ciliary body, choroid, ciliary body, iris, pupil. Okay, iris pupil. Okay, this one suspensory ligament. Okay, or suspensory ligament or zonular ligament. Zonular ligament. This part, zonular ligament. Okay, and this part, this is a fova centralis. This fova centralis. Fova centralis, optic disc. Optic disc, fova centralis. Optic disc, fova centralis. Optic disc, fova centralis. Fova centralis. Okay. Sense ear. Okay, external ear, inner ear, and outer ear. Here, auricle, this is a helix. Okay, anti-helix.
Yes.
Okay, navicular fossa, scaphoid fossa, or no, navicular or scaphoid fossa, and triangular fossa. Okay, concha. Okay, tragus.
Yes.
And antitragus. Okay, tragus, antitragus. Tragus, antitragus. External acoustic, meatus. External acoustic, meatus. Okay, and another part is location of the
Tympanic membrane.
okay, location of the tympanic membrane. Tympanic membrane. This part, okay, and epitympanic fossa. Tympanic fossa. Okay, tympanic fossa. Eustachian tube. Tensor tympanic muscles, and this one imminence. Okay, promontorium imminence. Promontorium. This one, promontorium. Okay, this one, promontorium. Cochlear nerve, this vestibular nerve. Cochlear nerve, vestibular nerve, vestibular nerve. This is this one round, okay, round foramen or window, and oval window. Foramen, okay. This semicircular.
Canals.
Anterior, semicircular, anterior, okay, and semicircular. No. Okay. Lateral, semicircular, lateral, and semicircular. Okay, superior or anterior, and this is posterior. Okay, posterior. Okay, semicircular, posterior, and lateral and superior. Okay, this one cochlea, scala, vestibular, scala, tympani. This is
This is spiral.
no, this. Primary spiral, okay, primary spiral, lamina. Primary spiral, lamina. And this foramen, helicotrema. Okay, again, scala vestibular, scala tympani, primary spiral lamina, helicotrema, and another part, this part, okay, oval window or foramen, round window or foramen, and this is this one. Cochlear nerve, vestibular ganglion. This vestibular ganglion, red part, vestibular ganglion, vestibular nerve, facial nerve. This facial nerve, three nerves: cochlear nerve, facial nerve, vestibular nerve, vestibular ganglion. Okay, vestibular ganglion, and another is sac. Okay, sacul, Okay, this sacul and this otricule largest part, otricule, sacul, small, sacul, otricule, sacul, otricule. Okay, sacul, otricule. Okay, exact. Cochlear,
Cochlear.
okay, vestibular, facial, ganglion, helicotrema, primary spiral lamina, scala tympani, scala vestibular, okay? And another part, skull, okay? Anterior and median line, this part, foramen secum, crista galli, olfactory groove, this part, genome sphenoidal, okay, genome sphenoidal, and this part body of sphenoid, optic canal, tuber syndrome, chiasmatic sulcus, and fossa, sella torsica, hypophyseal fossa, all sella torsica, deeper part, okay, hypophyseal fossa, and another part anterior clinoid process, middle clinoid process, posterior clinoid process, and dorsum sella. Okay, good.
Good, sir.
Dorsum sella, clevius. Okay, all of part questions final. Okay, clevius, foramen secum. Okay, jugular tubercle, jugular process. Jugular process, inferior surface of the skull, but jugular tubercle superior. Okay, intracranial, extracranial fossa. Okay, and another part, this part, anterior internal occipital protuberance, and internal occipital crest, external occipital protuberance, and external occipital crest, superior cervical or nuchal line, and mid and inferior and highest are nuchal, no problem. Okay, and another part, lateral part, this part, lesser wing, okay, lesser wing, and greater wing of the sphenoid. A greater wing contains three between of the lesser and greater, this superior orbital fissure, okay, and another part of the round rotundum foramen, oval foramen, spinosum foramen, anterior foramen, rotundum foramen, okay, exit of the maxillary vein, and this oval foramen mandibular, okay, lesser petrosal nerve, accessory meningeal nerve, okay, emissary, okay, no problem. Okay, this part, spinosome, exit of the middle meningeal artery, rotundum, oval, and spinosome. And another part is petrous part of the temporal, superior border or superior petrosal sinus. This superior petrosal sinus, inferior petrosal sinus, and the apex of the petrous, this part arcuate eminence, subarcuate fossa, arcuate eminence anterior surface, subarcuate posterior surface, internal acoustic meatus, external acoustic meatus, okay, external and internal acoustic meatus. Internal acoustic meatus.
Final.
Okay. And this is this one jugular
Jugular
foramen, jugular foramen, jugular fossa. This part jugular fossa, jugular foramen, jugular fossa, jugular fossa. Okay, jugular fossa. And another structures this part hypophyseal canal, hypophyseal canal, basilar part of the occipital, basilar part of the occipital, and another part transverse sagittal. Okay, this part sigmoid sulcus, transverse sagittal sulcus, sigmoid sulcus, sigmoid sulcus. Okay, all of internal cranial structures very important, and another incisive, okay, fossa, incisive fossa. This part palatine process of maxillary, transverse plate of the palatine and vertical plate of the palatine, posterior spine nasal,
Nasal spine.
anterior spine nasal, posterior spine nasal, and all of the vomer, all of the vomer, and the vomerovaginal
Vaginal process.
foramen, vomerovaginal foramen, pharyngeal tubercle, condylar process, condylar fossa, okay, condylar fossa, and this is jugular process. This is tubercle process, okay, jugular process, and another part, this part, a medial petrigoid plate of the petrigoid process and lateral plate. Scaphoid fossa. This part, scaphoid posterior border of the medial plate, superior part, bifurcation, formation of scaphoid fossa. This scaphoid fossa, this one scaphoid fossa. Okay, again, lateral plate of the petrigoid process, medial plate of the petrigoid process, and the scaphoid fossa. Very important, scaphoid fossa, petrigoid fossa, largest, okay, largest fossa, petrigoid between of the lateral and medial plate. Did you understand this? It's very important. And another part, this part, okay, foramen lacerum. Is foramen lacerum, irregular foramen, name foramen lacerum, foramen lacerum, foramen lacerum, and
Carotid.
okay, this foramen oval, spinosum oval, carotid canal, inferior part of the petrous, carotid canal, okay, carotid canal, and this jugular foramen, jugular process, styloid process, occipital, okay, occipital groove, and mastoid notch. This one mastoid laterally mastoid notch, medially occipital groove, and mastoid process, mastoid notch, occipital foramen, again mastoid process, mastoid notch, and occipital foramen. Groove, occipital groove, okay. External acoustic meatus, okay, between of the escamus and the tympanic part, escamotympanic fissure, okay, this foramen temporal, infratemporal, and petrigoid, okay, trigomaxillary fissure, and petrigopalatine fossa, inferior orbital fissure, superior orbital fissure, superior orbital fissure, superior orbital fissure, inferior orbital fissure, superior orbital fissure, and inferior orbital. This one, this is
Inferior.
orbital fissure. This one,
Superior.
okay. This one,
Crista galli.
this is.
Jugular.
This one,
Internal gastric matters.
okay.
Opening of
Good.
internal
Okay.
gastric.
All of question final. Okay. Okay. And another external acoustic meatus, condylar fossa. Okay, condylar fossa. Okay.
Yes.
TMG, temporomandibular joint. Okay, temporomandibular joint. This part. Okay, and another this arcuate. This okay, zygomatic arch. Zygomatic arch. Zygomatic arch, a squamous part of the temporal bone. Temporal bone. This is this process, temporal process of the zygomatic process of the temporal formation of zygomatic arch. Okay, and anterior normal. This part glabella. Okay, glabella. And supraciliary arch, laterally supraorbital notch or foramen, not or foramen or notch. And another medially supratrochlear. Supratrochlear, this part, this is this supratrochlear. Supratrochlear, nasion, this part nasion, nasal bone, internasal fissure, naso. Maxillary fissure, and this is frontal process of maxilla, anterior nasal spine, and canine eminence. Okay, canine eminence. Okay, canine fossa. This part canine fossa, canine eminence, canine fossa. And the alveolar process of the maxilla. Alveolar process of the maxillary. Infraorbital foramen, okay? This infraorbital foramen and the lacrimal bone, anterior lacrimal crest, posterior lacrimal crest, anterior lacrimal crest, posterior lacrimal crest, between of the anterior lacrimal crest and posterior lacrimal crest, location of lacrimal sac. Lacrimal sac, okay, and the perpendicular plate of ethmoid, middle concha, inferior meatus, middle meatus, and superior meatus. Okay, all of questions of the skull, this part, and another part. Cells, sternocleidomastoid muscles. Okay, sternocleidomastoid muscles. SCM. Okay, and another muscles, infrahyoid muscles. These muscles, sternohyoid. Okay, sternohyoid. SCM, sternohyoid muscles, and sternothyroid muscles. Sternothyroid muscles and omohyoid. Okay.
Şikast.
No. Cut. Okay, cut.
Got it.
These muscles, thyrohyoid muscles. Thyrohyoid, sternohyoid, okay, and thyrohyoid. Sternohyoid, sternothyroid. Deeper muscles, superficial, okay, this is this one, sternohyoid, this one, deeper, sternothyroid, and thyrohyoid. thyrohyoid. Thyroid these muscles. Okay, and another muscles, the gastric muscles. The gastric muscle, anterior belly, okay, and posterior belly. Anterior belly, this one good. Anterior belly and posterior belly, intermediate tendon. Okay, intermediate tendon. These muscles, anterior, the gastric, anterior belly.
Belly of the gastric muscle.
Okay, the gastric muscles contains two belly, posterior and anterior. Anterior belly, posterior belly, intermediate tendon. Okay, intermediate tendon and another muscles. This muscles, mylohyoid muscles. Mylohyoid. And deeper muscles, geniohyoid. This muscles, geniohyoid. Geniohyoid. Okay, and this nerve, this nerve, hypoglossal nerve. Okay, hypoglossal nerve, which spinal nerve together by hypoglossal. Which branch? C1. Very good. Okay, C1. C1. Okay, this innervated of the C1. Innervated of thyrohyoid, C1. C1 innervated of thyrohyoid and geniohyoid. This C1. C1 and hypogloss. C1 and hypogloss. Again, very important questions. Okay, final. Okay, this is
C1.
C1 hypoglossal.
Show us again.
Hypoglossal C1.
C1.
Hypoglossal nerve C1. Okay, narrow branch. Okay, and another. This is this one. Okay, this one. Internal jugular vein. Internal jugular vein, very important. Which structures? Internal jugular vein cut and another common carotid artery. Common carotid artery is common carotid artery. Internal jugular vein, posterior structures of the vagus. This one nerves, vagus nerve. Okay, this vagus. All of structures covering by carotid sheath. Okay, one common carotid, two vagus, three internal jugular vein. Internal jugular vein, and this one external. Okay, internal carotid artery, external carotid artery, external carotid artery, superior thyroid artery, first branch. Okay, and another branch, this branch. Okay, no, enough. Okay, superior thyroid artery. And another structures of this part, brachial plexus and scalene muscles. All of scalene muscles, 4 or 3? Three. Anterior, medial, and posterior. Okay, good. Anterior, this one, phrenic nerve. Phrenic nerve. Okay, this one phrenic nerve. Phrenic nerve. Okay, this is phrenic nerve. Okay, phrenic nerve relation by anterior surface of the anterior scalene muscles, and this is scalene is anterior scalene muscles, and this muscles medial scalene muscles and posterior scalene muscles. Posterior scalene muscle, posterior, medial, anterior. Between of the middle scalene muscles and the anterior scalene muscles, location of the brachial plexus. Brachial plexus contains a formation from C1 to T1, C5, C4, C5,
six, seven, eight,
C5, 6, okay, 7 and 8, T1, T1, okay. This is C5 and C6, formation of upper trunk. This upper trunk. 7, root formation of the middle trunk. C7, formation of middle trunk. C7,
C8. No, this is C7.
C8 and T1, C8 and T1 formation, middle, inferior
Inferior
trunk.
trunk.
Okay, brachial plexus contains any trunk, three, superior trunk, middle trunk, and inferior trunk contains any root nerves, C5, C6, C7, C8, T1. Okay,
T1.
T1.
Sir, can you tell middle scalene again?
Middle scalene. Okay, this is middle scalene. This, middle. Okay. Okay, good. Middle
posterior?
scalene. Posterior.
Subclavian artery.
Posterior. Posterior. Posterior scalene muscles. Middle scalene largest muscles and anterior. Okay.
First subclavian artery.
And this is nerve. This nerve.
Muscular
Suprascapular nerve. Suprascapular nerve. Suprascapular nerve and another this part.
आज कर देगा.
This art is subclavian. Subclavian. Okay. Subclavian arch. You know, man,
Like color.
in respect the posterior, posterior triangle teaching by Dr. Zalini. Okay.
Yes.
This part, this subclavian very important. Okay. Okay. Oh, okay. Subclavian thyrocervical artery. Subclavian. Okay. Subclavian artery. Okay. Between of the subclavian artery, between of the anterior scalene and middle scalene.
What's the
Okay.
red one and the blue
Okay,
one?
this is and this thyrocervical trunk, thyrocervical trunk. Okay, okay, enough. This
Subclavian when the
subclavian artery.
Where it is?
This
Okay.
subclavian
What's the pink and the blue?
trunk, thyrocervical trunk.
What is the pink and the blue?
This is?
No, pink, that pink.
Okay, middle brachial trunk, middle, okay, superior trunk, middle trunk, inferior trunk of the brachial, okay, brachial plexus. Okay, accessory, this one, accessory nerve. Accessory, okay, accessory.
11.
वेगस हो गई थी ना.
योगा से 20 में.
वेगस बीच में.
उन दोनों के बीच में.
हाँ. SMG.
Okay, this accessory nerve innervated of the SCM and trapezius muscles. All of branches of the suprascapular of the cervical branch, superficial branch of cervical. Largest branch, this largest branch, accessory root of the spinal root of the accessory nerve. Accessory nerve contains two roots, cranial and spinal. This is spinal root of the accessory nerve. Okay, and okay, submandibular gland, submandibular gland, submandibular gland. Okay, and another part, platysma muscles. Platysma muscles, SCM and platysma muscles, and another okay, this no masseter muscles. Okay, these muscles mentalis, okay, depressor angulioris and depressor labii inferioris, depressor angulioris, depressor labii inferioris, and mentalis orbicularis oris, and this one muscles, artery of the facial artery, buccinator muscles, buccinator muscles, facial artery, and another part muscles. These muscles, orbicularis oculi, orbital part, palpebral part, procerus muscles, corrugator superciliary muscles. Again, corrugator superior muscles, procerus muscles, and the orbital part of the orbicularis oculi, palpebral, and this part, okay, lacrimal part, deeper part. This nasal muscles, nasal, levator, palpebra, levator, okay, this is levator, levator labis superioris and alaka nazi, and levator labis superioris, levator labis superioris largest, levator labis superioris, levator labis superioris alaka nazi medial, and another part infra, these muscles, temporalis muscles, choroid process of the ramus of mandible, condylar process, external petrigoid muscles, this is external petrigoid muscles, and this one medial petrigoid muscles. This one medial petrigoid muscles, and lateral petrigoid muscles. Lateral, okay, this temporalis muscles, all of mastication muscles, four muscles, masseteric, okay, masseteric muscles, temporalis muscles, external petrigoid muscles, and medial petrigoid muscles, okay, medial petrigoid muscles, and this nerve, lingual nerve, mandibular nerve, mandibular posterior trunk of the mandibular, lingual nerve, inferior alveolar nerve, and okay, all of enough, inferior alveolar nerve, okay, inferior alveolar nerve, again, temporalis muscles, masseteric muscles, lateral petrigoid, medial petrigoid, this nerve, lingual nerve, cut, okay, inferior alveolar nerve, head and neck, enough, okay, okay, spinal cord, okay, spinal cord, spinal nerve, okay, spinal cord, spinal nerve, this nerves, this C1, okay, C1, C2, C3, okay, and this artery, vertebral artery, this artery, basilar artery, this is posterior cerebral artery, okay, posterior cerebral artery, basilar artery, vertebral artery, spinal, this medulla, this part medulla oblongata, continue of the medulla oblongata, formation of the spinal cord, and this nerve, C1, C2, okay, T nerve, T branch, and the lumbar branch, lacrimal, sacral branch, and coccyx, okay, all of part is part, okay, spinal. Finish, and another part, better. This is
lateral ventricle, anterior,
okay, lateral, posterior, anterior, and the fornix, okay, fornix, this fornix and ventricle, and this fornix. This one lateral, inferior surface of the hemisphere, okay, lateral, this lateral sulcus, lateral occipitotemporal sulcus, lateral occipitotemporal sulcus, this sulcus collateral sulcus, okay, collateral sulcus, occipitotemporal gyrus, okay, medial occipitotemporal gyrus, para-hippocampal gyrus, and this medial part, hippocampus, okay, hippocampus, and another part, okay, medial surface, this fornix, corpus callosum and fornix. Okay, this fornix. Corpus callosum contains rostrum,
board,
genome, okay, body or corpus, and splenium. And this is fornix. This one fornix. Between of the fornix and corpus callosum, formation of septum placidum. Okay, septum placidum. Septum placidum. Anterior commissure. This part is anterior commissure. This anterior commissure. And this one posterior commissure. Hysteria medullary thalami. This hysteria medullary thalami, and this is this one hypnular nucleus. Hypnular nucleus. This one thalamus. Hypothalamus. Hypothalamic fissure. Groove or fissure. Okay. Interventricular foramen or Monroe. Interventricular again. Corpus callosum, rostrum, genome, body, splenium, fornix, septum placidum, anterior commissure, posterior commissure, hysteria medullary thalami, hypnular nucleus, thalamus, this part hypothalamus, hypothalamic groove, Monroe foramen. And this is a cingulate gyrus. This gyrus paracentral gyrus, and sulcus parietoccipital. This sulcus parietoccipital sulcus, calcarine sulcus. Between of the calcarine sulcus and parietoccipital sulcus, formation of conus, pre-conus. Okay, conus and preconus. Superior, this one between of the fourth ventricle and third ventricle. Sylvius, okay, aqueduct, canal or Sylvius duct. Or aqueduct.
Aqueductal canal.
Aqueductal sulcus or canal. Okay, and this part tectum contains two structures, very important structures. Okay, superior colliculus, inferior colliculus. Superior colliculus, inferior colliculus. This is this canal, ependymal canal and fourth ventricle. Okay, Ola part, and this sulcus, cingulate sulcus, cingulate gyrus. Questions? This one.
Anterior commissure.
This one. This.
Trimedullary thalami.
Okay.
Septum pellucidum.
Okay, this is.
Cuneus.
This
Calcarean.
And lateral surface of the lateral surface. This is this one Sylvius sulcus. Sylvius sulcus. Okay, or lateral sulcus. Sylvius sulcus or lateral sulcus. Central sulcus. Post-central sulcus or Rolando, okay, and pre-central. Post-central gyrus, pre-central gyrus, and another gyrus, superior or frontal sulcus, inferior frontal sulcus, superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus, okay, Broca area and Wernicke area, intraparietal sulcus, okay, supramarginal, okay, supramarginal gyrus and triangular gyrus, parietoccipital, this parietoccipital sulcus, okay, and okay, pons, medulla oblongata, okay, corpus callosum, septum flacidum, fornix, interthalamic adhesion, Monroe foramen, and stereo medullary thalami, habnolar nucleus, anterior commissure, posterior commissure, okay, supra optic chiasma, okay, supra optic chiasma. This is mammillary body, and Silius sulcus, your aqueduct sulcus, anterior superior colliculus, inferior colliculus, this part tectum, fourth ventricle, nerves. This part bulb of the olfactory tract of olfactory nerve, optic nerve, okay, optic nerve, and this nerve, oculomotor nerve. This one, oculomotor nerve, posterior all of nerves, trochlear nerve, trigeminal nerves, okay, and abducen nerve, okay, facial nerves, vestibulocochlear nerve, abducen nerve, medial facial nerve, vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, accessory nerve, hypoglossal nerve, pons and medulla oblongata, pointomedullary sulcus, again, olfactory nerve, optic nerve, trochlear nerve, oculomotor nerve, trochlear nerve, hypoglossal nerve. Okay, this is trigeminal nerve again, olfactory, optic, oculomotor, trochlear, trigeminal, facial, okay, abducen 6 nerve, abducen, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal, medulla oblongata, pons, pointomedullary sulcus. This is a pyramid eminence and olive. Okay, olive, and another artery. This artery, anterior cerebral artery, calloso-marginal branch, precallosal artery, middle, anterior cerebral artery, calloso-marginal artery, precallosal artery, okay, and
यही बताते जा सारा बड़ा बहुत बड़ा है यार.
Again, this one, habnolar, stereomedullary, thalamic, fornix, septum flacidum, corpus callosum, anterior commissure, posterior commissure, Silius, fourth ventricle, cerebellar, and pons, medulla, pointomedullary sulcus, olfactory nerve. Okay, okay, this is a superior sagittal sinus, inferior sagittal sinuses, straight sinuses, superior sagittal sinuses, medial surface of the hemisphere. Okay, and a continue of the striate.
Confluence.
Lateral surface.
Okay, this one central sulcus, primary precentral gyrus, postcentral gyrus, superior frontal sulcus, inferior frontal sulcus, superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus. Okay, and another parieto is parieto-occipital sulcus,
मेन जो गलत है
This one frontal sinus, superior oblique muscles, and inferior oblique muscles, medial rectus, okay, lateral rectus, superior rectus, and this inferior rectus, optic canal, and this one lens. Okay, this lens.
ये जो
Lens.
सुनो यार ये जो क्या कह रहा है
Okay, lens, and this is this one
विट्रस बॉडी
vitreous body, lens and vitreous body. Okay. Okay.